Hello, everyone. Today we will be talking about fight and flight response. We'll talk about an action movie, which is the adrenergic receptors. In our body, we have the sympathetic nervous system is the one that help us at the time of danger, and the parasympathetic is the relaxed state when you're just chilling watching TV. So the adrenergic receptors are kind of complicated, and I struggle to understand them myself. But then when I came to these two rules, it changed my understanding and made it so easy to memorize and remember. So the rule number one is that when when you are at your home alone and you see this ghost running after you, you need to run away. So at that time, there are tissues that help you achieve the action movie. You run away, okay? And there are tissues that is not going to help you at that time. For example, the heart. We need to have the heart pump faster. The bronchioles of the lung need to dilate, relax. And the digestive system and urinary system need to shut down because it's not the time to digest my food. It's not the time to go to the bathroom. Okay? So the rule number one is that all tissues that need to be activated or constricted must have alpha 1 receptor, except the heart and the adipocyte. The adipocyte has a beta 1, a modified beta 1, which is beta 3, and the heart has beta 1. Okay, so this is rule number one. And we have rule number two is that all tissues that need to be inhibited must have a beta 2 receptor, except few. So we will discuss the smooth muscles first. The smooth muscles in the blood vessels that goes to the skin, it's not necessary. I don't need my skin at this time. So the smooth muscle need to constrict so that I have less blood flow going to the skin, so that I save my blood flow to the skeletal muscles. So the blood vessels that are going to the skin, the smooth muscle will constrict, which means alpha 1. So contraction, alpha 1. And the smooth muscles and the blood vessels that goes to the skeletal muscles, okay, I need it to be relaxed so that I get more blood flow. So this has beta 2, which is relaxed, mean beta 2, relaxed. The airways, as I said, is very important at this moment. I need to have my airways dilated so that I get more oxygen to my body, so I get more energy. So the airways relaxed, which means beta 2. And good to know that when people who have asthma, we give them albuterol, which is a beta 2 agonist that dilate the bronchioles. Okay, so it mimics sympathetic response. Now these two, the digestive and urinary system, we don't need them. So the digestive system, in order to shut down the digestive system, the digestive system, there are two muscles, the longitudinal muscles and the circular ones. So the circular muscles, I need to contract them, and the longitudinal muscle, I need to relax them. So I need to do both of these at the same time for the digestive system to relax and to be inhibited from its work right now. So the longitudinal muscles that are going to be relaxed, beta 2, and the circular that's going to constrict, alpha 1. So same rule. Rule 1, constrict, alpha 1. Dilate, relax, beta 2, rule 2. The urinary bladder, we have two types of muscles in the urinary bladder. The detrusor muscles, the one I need it to relax so that I get it filled with more urine because it's not the time to go to the bathroom. And the sphincter muscle, I need it to constrict. So constrict, what does that mean? Alpha 1, good job. And relax, what does that mean? Beta 2. Excellent. Now, the eye, that's interesting in it too. So we have the dilated pupillae And we have the ciliary muscle, the dilator pupillae. Let's come to it. Dilator pupillae, it dilate the pupil so that I see more. I have a better vision. So when I have ghosts running after me, right, I need to see more and I see better. So the dilator pupil I need to constrict so that I see more. So constrict, what does that mean? Correct, it's alpha 1. How about the ciliary muscle? The ciliary muscle controls the far vision and the near vision. So in order to have the ciliary muscle, the eye see the far vision, because that's what I need at the time of fight and flight. I need to see for further vision. So the ciliary muscle need to relax, let go of the pupil so that the pupil can see to the further vision. So what type of receptor if it's relaxed? Yep, you're right, it's beta 2. Now the adipocyte. Adipocyte is a store of energy, the triglyceride that I need it when someone is running after me. So in order to break down the triglyceride to the glucose, so I need to activate the lipase so that to break down the triglyceride. So adipocyte is one of the tissues that need to be activated. Okay, so the rule says all tissues that need to be activated must have alpha 1, except heart and adipocyte have beta 1. So adipocyte have beta 1 or modified beta 1, which is called beta 3. Okay, and the skeletal muscle, liver and skeletal muscle, it's a store for glycogen. So, and there are two biochemical mechanisms that are going on inside. One's called the gluconeogenesis, which is the one that transfers sugar to more complex molecules that I can't use. And there one, the glycogenolysis, is the one that breaks down the glycogen to glucose. So at that time, I need to inhibit the gluconeogenesis so that the glycogenolysis proceed and give me more glucose. So that's why liver and skeletal muscle have beta 2, because they need to be inhibited. And the heart is the last one. The heart, what do you think? What do you think I should do with the heart? Do I want it to pump faster or pump slower? Correct. I want it to pump faster because this is very urgent situation. I need my heart to help me out. So in order to pump faster, I need to activate it. And the rule number 1 says all tissues that need to be activated must have alpha 1, except heart and adipocyte that have beta 1. So the heart has beta 1 receptor. That's why people who are tachycardic, which mean they have a fast heart rate naturally, or due to disease or whatever, I want to control their heart rate, or atrial fibrillation that causes the heart to pump faster, I give them metoprolol. Metoprolol is a beta 1 antagonist that block the beta 1 so that I let the heart relax. Okay, so this understanding of the adrenergic receptors will help us understand our physiology and the medications. Why do we give every medication? Okay, and in a recap, just a quick review of what we discussed. The smooth muscles that run to the skin, blood vessels to the skin, alpha 1. The constricted alpha 1. The blood vessel to the skeletal muscle, relaxed beta 2. Bronchial airway, relaxed beta 2. Digestive system, longitudinal muscle, beta 2, relaxed. Circular muscle, contracted alpha 1. Urinary bladder, detrusor muscle, beta 2, relaxed. Sphincter muscle, alpha 1, constricted. And the eye, dilated pupillae, constricted alpha 1. And ciliary muscle, relaxed beta 2. And this is important about how to manage glaucoma. We'll talk about it later. Adipocyte has beta 3, which is modified beta 1. The one that need to be activated is one of the exceptions. Liver and skeletal muscle beta 2, and the heart, finally, we have beta 1, because rule number 1 says all tissues that need to be activated must have alpha 1, except heart and adipocyte that have beta 1. The heart has beta 1. It's one of the tissues that need to be activated. Okay, thank you so much for listening. Please leave me feedback if you think that I can improve in any way. Thank you very much, and you have a wonderful day.